I want to tell you about a man named Raymond Carter. Raymond was 67 years old, retired electrical engineer. He spent 40 years being careful. Careful with money, careful with his work, careful about following the rules. And he was careful about his health, too. He didn't smoke. He barely drank. He walked every morning. He took every pill his doctor prescribed. And he was on 4 of them, 4 separate blood pressure medications. And still, when I opened his chest on my operating table, what I found stopped me cold. His arteries looked like corroded concrete pipes, hard, stiff, narrowed from the inside by decades of silent damage he never felt, never saw coming, and was never warned about. He had done everything right by every metric his doctors had given him. And there he was, 67 years old, on my table with a cardiovascular system that looked 20 years older. I've spent over 30 years as a cardiac surgeon. I've held human hearts in my hands. I've repaired vessels that should have been replaced decades earlier. And I'll tell you what I've learned from standing inside thousands of human chests. The damage almost always starts long before anyone notices. And in most cases, the biggest missed opportunity wasn't a medication. It was the kitchen. Because what Raymond ate 3 times a day, what most people eat 3 times a day, was quietly feeding the very inflammation destroying his blood vessel walls. And nobody told him. Not because his doctors were negligent. They're good people working in a system that doesn't give them time to explain this. But somewhere between the science and the patient sitting at the dinner table, this information got lost. Today, I'm going to give it back to you. 5 specific, research-supported dietary changes that work on the root cause of high blood pressure after 60. Not replacing your medication. I want to be crystal clear about that. But giving your body the tools it needs to work alongside whatever your doctor has prescribed. These are the things I now tell every one of my patients before they leave my care. And I wish I had been saying them for 30 years longer. Stay with me. Because by the time this is over, you'll know exactly what to do starting tonight. Before we get to the 5 things, you need to understand what's actually happening inside your arteries as you age, because this changes everything. Here's the most useful analogy I know. Picture a garden hose. When it's new, it's flexible. It stretches and bends. When water pressure surges through it, the walls absorb the shock. Now picture that same hose after 15 years sitting outside in the sun. It's stiff, it's brittle, it doesn't bend anymore. And when pressure hits those rigid walls, it doesn't absorb. It strains. That is your cardiovascular system after 60. And the process that turns flexible vessels into rigid ones isn't just aging, it's inflammation. Chronic, low-grade, invisible inflammation in the walls of your blood vessels. You don't feel it. There's no alarm. But year after year, it quietly stiffens those walls, narrows the channels inside them, and forces your heart to work harder just to push blood through. Here's what makes this so important. What you eat 3 times a day is either reducing that inflammation or fueling it. Every single meal is a decision your cardiovascular system has to live with. And most people, without realizing it, are fueling the fire every day. So let's put it out. Here are the 5 things. Starting with the one that costs you nothing and requires no new groceries at all. Change number 1. Eat your vegetables first. Every meal. Before the bread, before the protein, before anything else on that plate. I know. You've heard so much health advice over the years that something this simple sounds like it can't possibly matter. But I want to show you exactly why it does, because the mechanism here is real and measurable. When you eat vegetables at the beginning of a meal, the fiber in those vegetables forms a physical structure in your stomach, a kind of mesh barrier. That barrier dramatically slows down how quickly sugars and carbohydrates from the rest of your meal enter your bloodstream. And that timing matters enormously for your blood pressure. Here's why. Every time blood sugar spikes sharply after eating, which happens when carbohydrates hit an empty stomach with nothing to slow them down. Your body releases a surge of insulin to manage it, and that insulin surge signals your blood vessels to constrict, to tighten. Right there at the dinner table, invisible to you, your blood pressure is climbing. When vegetables come first, that spike is blunted. The rise in blood sugar is slower, gentler, and your body's insulin response is smaller and more controlled. The result: lower post-meal blood pressure readings. I've had patients who changed nothing else. Same kitchen, same food, same portions, same medications. Only the order changed. Vegetables first, then protein, then carbohydrates last. Within 2 to 3 weeks, their post-meal readings were measurably lower. One of my patients, a retired school librarian named Carol Hutchins, 71 years old, told me after 3 weeks. I kept waiting for the hard part. There wasn't one. She was right. It's just order. It costs you nothing, but it changes what your cardiovascular system experiences after every single meal for the rest of your life. Tonight at dinner, finish every vegetable on your plate before you touch anything else. That's it. Start there. Change number 2. 1 to 2 tablespoons of diluted apple cider vinegar with each meal. I'm going to ask you to hold off on the skepticism for just a moment, because I felt it too when I first encountered this. I'm a surgeon. I deal in data, and what the data actually shows surprised me. The active compound in apple cider vinegar is acetic acid, and acetic acid does 2 specific things that are directly relevant to blood pressure. First, it measurably improves insulin sensitivity. Remember the blood sugar spike we just talked about? Acetic acid blunts that spike even further. It helps your cells respond to insulin more efficiently, which means your body doesn't need to release as much of it. Less insulin, less vessel constriction, steadier pressure. Second, and this is the part that genuinely caught my attention in the research, acetic acid appears to support the production of nitric oxide in blood vessel walls. Nitric oxide is your body's own natural vasodilator. It sends a chemical signal to your arteries. Relax. Open. Let the blood move freely. It's essentially doing through natural dietary means what an entire category of blood pressure medications is designed to do pharmaceutically. Now, one essential caution. Never drink it straight. Undiluted vinegar is acidic enough to damage tooth enamel and irritate the lining of your esophagus. Always mix 1 to 2 tablespoons into at least 8 ounces of water. Use a straw if you can. And if you have a history of acid reflux, gastritis, or stomach ulcers, check with your doctor before making this a daily habit. For most people over 60 without those conditions, this is one of the simplest, lowest risk additions I know of. 1 glass with breakfast, 1 with lunch, 1 with dinner. Give it 3 full weeks before you judge it. Check your numbers at the start and at the end. The results often speak clearly. Change number 3. 30 grams of walnuts, approximately 14 halves, eaten 30 minutes before you go to sleep. This one addresses a problem that I consider one of the most underdiagnosed and quietly dangerous patterns I've seen in cardiovascular medicine: nocturnal hypertension. Most people check their blood pressure in the morning. What they don't realize is that for many adults over 60, the more important numbers are the ones happening while they're asleep, and those numbers can be wildly different from the daytime reading. In a healthy cardiovascular system, blood pressure drops naturally during sleep. It's called the nocturnal dip. It's your heart's opportunity to rest and recover. But in a condition called nocturnal hypertension, that dip doesn't happen. Pressure stays elevated, or even spikes during the night. And while you're lying there completely unaware, your heart is working overtime, your arteries are under sustained stress, and your risk of stroke and heart attack the following morning is significantly elevated. Your regular daytime readings won't catch this. You can have perfectly acceptable morning numbers and still have a serious problem happening every night. The only way to truly know is overnight monitoring, something worth discussing with your cardiologist. But here's where walnuts come in. Walnuts are one of the richest plant-based sources of alpha-linolenic acid, a plant form of omega-3 fatty acid with meaningful anti-inflammatory effects on blood vessel walls. They also contain melatonin, yes, the same compound involved in your sleep cycle, and an amino acid called L-arginine, which your body uses to produce nitric oxide. Together, these compounds support your arteries' natural ability to relax during the night and encourage that healthy pressure drop your cardiovascular system needs. 30 grams, 14 halves, 30 minutes before bed. It's not a dramatic intervention, but in multiple studies, the effect on nighttime pressure readings has been real and consistent. Think of it as sending your cardiovascular system a clear signal. The day is over. Stand down. Change number 4, 3 cups of hibiscus tea every day. If you've never heard of hibiscus tea, you may know it by other names: sorrel, carcade, red tea, or agua de Jamaica. It's made from the dried petals of the hibiscus flower. It has a deep ruby color and a tart, cranberry-like flavor, and it has been used in traditional medicine across parts of Africa, the Middle East, and Latin America for generations. Modern cardiovascular research has finally caught up with what those traditions were observing, and what the science shows is genuinely striking. Hibiscus petals contain compounds called anthocyanins and hibiscus acids. These compounds interact with your blood vessel walls in a way that closely parallels how a class of prescription blood pressure medications called ACE inhibitors work. ACE inhibitors are among the most prescribed cardiovascular drugs in the world. What they do is block an enzyme that signals your blood vessels to constrict. Hibiscus appears to support a similar pathway through entirely natural mechanisms. A peer-reviewed study published in the Journal of Nutrition found that adults with mildly elevated blood pressure who consumed hibiscus tea daily experienced an average reduction of 7 points in systolic pressure. 7 points. That is not a trivial number. That is a clinically meaningful result. 3 cups a day, hot or cold. With minimal or no added sugar, sugar actively works against the anti-inflammatory effect we're trying to support here. A small amount of honey is acceptable if you need it. A warm cup in the morning, 1 in the afternoon, 1 in the evening. It's pleasurable, it's inexpensive, and your arteries will notice. One important note: if you are currently taking an ACE inhibitor medication, please speak with your doctor before adding hibiscus tea regularly. Combining a natural compound with similar action to an ACE inhibitor alongside the pharmaceutical version can push your pressure lower than intended. That's not the goal. We want improvement, not overcorrection. Your doctor is your partner in calibrating this. Change number 5. And I want you to pay close attention here, because this may be the most structurally important change on this list, and it's also the one that food industry marketing has made the most confusing. Replace the cooking oils in your kitchen. Go to your pantry right now, after this video, and look at what oils you have. If you have canola oil, soybean oil, corn oil, or sunflower oil, I want to explain to you what those oils are doing inside your body every time you cook with them. These oils are extraordinarily high in omega-6 fatty acids. Now, omega-6 is not inherently harmful. Your body needs some of it. The problem is the ratio. For most of human history, people consumed omega-3 and omega-6 fatty acids in roughly equal proportions. Today, the average American consumes somewhere between 15 and 20 times more omega-6 than omega-3. That extreme imbalance is one of the most potent drivers of the chronic systemic inflammation we've been talking about this entire time. The kind that silently stiffens artery walls year after year, while you feel nothing. And here's what makes it worse. These refined vegetable oils are chemically unstable at the temperatures required for cooking. When you heat canola oil or soybean oil to sautéing temperature, they oxidize. They break down into compounds called aldehydes, substances that research has linked directly to damage of blood vessel linings. You can't taste it. Your food looks normal, but the harm accumulates with every meal cooked in these oils. So what do you replace them with? 2 things. Extra virgin olive oil for everything that doesn't require very high heat. Salad dressings, gentle sautéing, drizzling over roasted vegetables, finishing soups. Extra virgin olive oil is rich in oleocanthal, a natural anti-inflammatory compound, and in monounsaturated fats that actively support blood vessel health. Decades of rigorous research back this without serious debate. For higher heat cooking, use real butter. Traditional butter from grass-fed cows if you can find it. Not margarine. Margarine is made from the same refined vegetable oils we're trying to eliminate, often in a hydrogenated form that's even more problematic. Real butter, used in reasonable amounts, is a significantly better choice for your cardiovascular system than the seed oils most people cook with daily. I understand this contradicts what many of you were told 20 or 30 years ago. The butter is dangerous. Use vegetable oil message was everywhere. I heard it too, early in my career. But the science on this has genuinely evolved. And after looking inside thousands of human chests, I can tell you that the evidence now points clearly in a different direction. You don't have to throw out what you have today, just stop replenishing it. When your current bottle of canola oil runs out, replace it with extra virgin olive oil. That single substitution, sustained over 3 to 6 months, can produce measurable reductions in your inflammatory markers. And lower inflammation means more flexible arteries. And more flexible arteries mean lower blood pressure. Let me bring this all together, because I know that when you hear 5 things at once, the risk is that you remember none of them. 1. Eat your vegetables first at every meal, before anything else on the plate. 2. 1 to 2 tablespoons of apple cider vinegar and water with each meal, 3 times a day. 3. 30 grams of walnuts, 14 halves, 30 minutes before bed. 4. 3 cups of hibiscus tea daily, hot or cold, minimal sugar. 5. Replace canola and soybean oils with extra virgin olive oil and real butter. 5 things. No prescriptions, no exotic supplements, no expensive equipment. Each one works through the same fundamental mechanism, reducing vascular inflammation and supporting blood vessel flexibility. 5 different approaches, all addressing the same root problem. Now here's what I want you to do before you close this video. Not all 5. Just one. Pick the one that feels most manageable tonight. Maybe it's simply finishing your vegetables before anything else at dinner. Maybe it's ordering hibiscus tea online. Maybe it's checking that oil cabinet. Just one. Start tonight. Because sustainable improvement doesn't come from overhauling your entire life in a single week and burning out before the month is over. It comes from one decision, repeated consistently until it becomes invisible, until it's simply how you live. Raymond Carter came back to see me 6 months after his surgery. He'd made every one of these changes slowly, carefully, in close communication with his cardiologist. When he walked into my office, he looked different, lighter somehow. His physician had reduced him from 4 blood pressure medications to 2. His inflammatory markers had improved substantially. His pressure was stable, genuinely, consistently stable, for the first time in years. The first thing he said to me was, "Why didn't anyone tell me this before?" That question stays with me. It's part of why I keep sharing this information. Because the research exists, the evidence is there. But somewhere between the science and the patient at the kitchen table, it keeps getting lost. You are at that kitchen table right now, and you have everything you need to start tonight. Before I go, one thing I have to say clearly. Everything I've shared today is general information based on current research and my clinical experience. It is not a replacement for your personal medical care. Please do not stop, reduce, or adjust any medication without speaking directly with your doctor first. Bring this information to your next appointment. Have the conversation. Your doctor is your partner in this, and these 5 changes work best when they work alongside proper medical supervision. Your heart has been working for you every minute of your life, without rest, without asking for anything in return. The least we can do is give it the right environment to keep going. Starting tonight.